Professor. My name is Sheetal and my student ID is 1199976249. Today I am going to perform the procedure of wound dressing, and here is a 360-degree view of the room. Hi, how are you?
I'm good.
My name is Sheetal and I am your student nurse for today. I have the prescription for changing your wound dressing. Are you comfortable?
Yes, I am.
Okay, can you please tell me your name?
Devasish Deva,
Okay, your date of birth?
14 June 2001.
Okay, can I show your wristband as to cross check? Okay, and I'm gonna perform the hand hygiene. Privacy is maintained. So before starting, let me ask you some questions. Do you have pain in the wound?
Yes,
Okay. On the scale of 1 to 10, 1 being the least, 10 being the most, how can you rate your pain?
around 3.
Okay. Do you need any medication? Okay. Are you allergic to any drug?
No.
Okay. Here I can see that the patient pain level is 3, which is considered to be mild pain, and she doesn't need any medication. Also not allergic to any drug. Now I'm gonna reposition the bed. Open the absorbent sheet as to prevent from spilling. Diva, please put your hand here. Okay. Now I'm gonna done the hand washing and wear my gloves. Okay, now I'm gonna proceed with the setup of my spiral tray. For this, I'm gonna remove the flap away from me, then to the right, then left. Before removing the last one, I'm gonna grab my forceps and arrange my tray to create a sterile triangle. Make sure it will not touch anything, and arrange my forceps accordingly. And place the forceps on the edges. Pour some saline solution onto it. Okay. Now I'm gonna proceed with the inspection. For this, firstly I'm gonna remove the dressing. Diva, please let me know if you feel any pain. Okay. On the dressing, as I can see, there is a purulent discharge which is yellowish green in nature. Also, the discharge is viscous and low, which directly indicates the bacterial and infectious growth. In real life scenario, we don't use it and just throw it, but in my scenario, I don't have another, so I'm keeping it here for use. Okay, now I'm gonna inspect the wound. Okay, for this, the wound is present on the lateral aspect of the right arm in the medial line. Now I'm gonna check for the approximation and wound closure. The wound is enclosed with 6 to 8 staples, and the edges are closed. Also, the proximity is well maintained. Now I'm gonna check for the length. For this, I will give my scale. Make sure it would not touch the wound. Okay, the length is about 8 centimeter. I'm gonna check for the erythema. As I can see, there is no redness present. Now I'm gonna start with the palpation. For this, I will put pressure. Diva, please let me know if you feel pain. Okay, there is no sign of edema and pain. Now I'm gonna check my gloves and putting a new sterile dressing, but I don't have another, so I'm gonna reuse it. Now I'm gonna clean the wound. For this, I will hold my forceps, grab the gauze, dip it in solution and just squeeze it, and clean the wound from top to bottom, in the foot and to head end, near to the midline, in just a single stroke, and just discard it. Doing same with another swab. Just dip it, squeeze it, and clean the further side from top to bottom in just single stroke and discard it. Again, dip it, squeeze it, and clean the nearest side, foot end to head end, and just discard it. Now I'm gonna pat dry the wound. Just patting drying the wound towards the midline. Discard it. Same towards the farther side in just a single stroke. And the last about to the nearest side and just patting it dry and discard it. Now I'm gonna place the sterile gauze on the wound. And place my forceps on the edges. Now I'm gonna secure the wound and place the new sterile dressing. Write the time and date so the nurse on the another shift will get to know about when the dressing was last changed. Now I'm gonna reposition the bed, making the patient comfortable. Are you comfortable?
Yes.
Okay. Here is the call bell. If you feel any need, please press the bell and I will be there. Now I'm gonna discard my splice accordingly, and here I am done with the wound dressing video, and here is a 360-degree view.